Hey everyone, welcome back to Raising Me and Mine, and we are back. We are better. We are like a toddler that's just woken up from a nap, running through the doors. So it is Aisha
and Audrey,
and we have a lovely guest with us today. We are super gassed. We can't wait for you guys to see the episode and hear all of the information she has to share with us today. We have Dr Nagla with us today.
Hi guys, thank you for having me.
Thank you for coming. Honestly, we really do appreciate it. Dr Nagla is a fertility doctor. I guess I will let you introduce yourself.
Like you say, so I'm a resident doctor in obstetrics and gynecology. Amazing. And at the moment I'm doing a fellowship in fertility. So I work in an IVF clinic in London and basically see people all throughout their journey, whether they're thinking about freezing their eggs or they're struggling to get pregnant, all the way through really.
And what made you want to get into this line of work? Like, obviously we're so grateful, but what made you want to do it in the first place?
Yeah. So since medical school, I had a placement on the labour ward and I was like, oh my God, this is amazing. You basically get to be a part of the most important day of someone's life, but every day of your life. And that's what got me into it. And then as I went through, I did an attachment in an IVF clinic. And I actually saw a woman who was 28 at the time and had been diagnosed with breast cancer. And she was freezing her eggs before she was having chemotherapy. And I thought to myself, hang on, I'm a medical student and I didn't know that having this treatment could affect your future fertility. Yeah. So if I don't know it, then what are the odds that people generally know this kind of information? And it was from that journey onwards. I mean, it's amazing to be there during someone's delivery, but actually sometimes some of the most rewarding things is being with someone really when they're in the struggle. So from that point onwards, I was like, okay, this is it. This is what I'm doing.
That is so dope. Because amazing. Usually when people go to, like, when you hear doctor, you just think like a GP or a pediatric nurse. When I came across your page, I was like, a fertility doctor? Like, how do you even get into that? But I love the content you create and stuff. So that's why we wanted you here.
Thank you. Absolutely.
But before we go into conversation, I think we need to learn more about you as a person. So outside of being a fertility doctor, medical school, being a mum, who is Nagler is your first name, right?
It is, yeah.
So who is Nagler?
So to be honest, sometimes I'm like, who am I? Because I feel like between going to work and looking after a toddler, there's like no hours left in the day.
Absolutely.
But yeah, I'm just somebody who's really passionate about women's health. But outside of that, I guess I have some interests. Like I enjoy reading and cycling and running. But at the moment, it feels like there's no time outside of being a mum and going to work, really.
Where are you from? What background? What's your background?
I'm from Sudan.
Oh, you're right next to me. I'm from Uganda.
Oh, cool. I've been to Uganda, actually.
Yeah, have you?
Yeah. So I was born in Sudan.
Okay.
And we moved to the UK. We moved to Sweden first and then the UK when I was around 7.
Yeah.
So I've always grown up in like East London, Essex.
Oh, okay. And loads of Ugandans are in East London.
Yeah. So a local girl.
Yeah, that's like me. I'm a resident, well, apart from the doctor part. The East London and Essex part.
Yeah.
You got me right there. But what was your pregnancy like? And how is it hard to detach when you have so much information when you're in the situation yourself?
My pregnancy, thankfully, was straightforward. Yes. I mean, the thing is, lots of people just go through their entire pregnancy and their entire delivery never having seen a doctor because things are just low risk and going to plan. But because we get involved when things are maybe not going to plan, you end up having this very skewed view of like the risks and things. So I'd find myself like going to scans and like holding my breath, like thinking I can only breathe like when I know everything's okay. Whereas my husband, who's not medical, was just like, la la la, like just not expecting anything to go wrong. And as I say, it was thankfully all straightforward, but you do always have all these kind of like risks in your mind and things.
Of course.
Yeah.
I can imagine actually, because you have so much information when it's you on the other end. Every possibility is probably running through your mind, right? Whereas like you said, your husband goes in, like we just go in and be like, scan.
And I think
you don't think of what they possibly could tell you.
Yeah.
That's so true. And I think that's very similar to just getting pregnant in general. Like, if I guess we're going to go into the conversation now. I remember for years, I didn't even think about fertility issues at all. Like, growing up, I didn't even think it was a thing. I just assumed all women could get pregnant. And it's just a matter of when you're ready, you will do it and it will happen. I never ever gave any thought about the process or anything like that. And funnily enough, like, you spend so much time trying to not get pregnant.
Exactly.
And then it's just like, when the time comes, it's like, oh. And for me, like, my experience with infertility or fertility issues, where I saw friends going through it, and that was the first sort of like signifier for me. I was like, what do you mean, like, this happened? And what do you mean, like, and I'd heard of the word miscarriage, but you don't really think about it, like, it's just like a passing thing, like, when you're not in that frame of mind of, I'm trying to have a baby right now. So things kind of just, you know, they're kind of by the by. Of course they're not, but at the time it was. So I just didn't think about it until I started having friends that were going through it, and I was like, oh, okay, this is a thing. Like, it's,
and like,
no joke.
Mentioning, you know, like, you have people that have so I've had miscarriages, but fertility and miscarriages, correct me if I'm wrong, are like completely different. You can get pregnant. Some people can continuously get pregnant, but their body just cannot like carry the baby full term. So when it comes to that fertility side, I guess what would you say is, I don't know, if you're trying to have a baby, like first time trying to have a baby, what are the things that you would say to, I guess, a woman or and a man, because male fertility does absolutely impact it all as well. When they're trying to conceive.
So like you say, I mean, all we're ever taught is how to not get pregnant. So we just think, okay, well, we'll take away the contraception and have sex and we'll be pregnant. But it's not always that straightforward. But to anybody who is trying to get pregnant or thinks that having a family is definitely something that they want in the future, then, okay, let's take, for example, just a couple now who's getting ready to get pregnant. So the first things I would do is take your supplements. So there are so many like nicely branded supplements out there, and some of them are really expensive, but the main things that you actually need are folic acid. And folic acid doesn't help you to get pregnant. And I see this a lot, that people think it's like a pregnancy supplement, but it actually helps the baby's development when you are pregnant. And also a vitamin D, because most people in this country are vitamin D deficient. And then have a look at your lifestyle. So things like quitting smoking, reducing or completely cutting out alcohol. And that's for both male and female partners, because we know it affects egg quality and reserve and sperm quality as well.
Really?
Yeah.
Does it affect it a lot? Because, you know, we're in a day and age where people are living life and partying, smoking shisha, doing all of that. How much of an impact is it?
So one of the big differences between men and women is women, we are born with all of the eggs that we're ever going to make, and they will just decline basically over the course of our lifetimes. But men produce sperm every single day, but it takes about 3 months to reach the ejaculate. So any changes that you make in your lifestyle any changes you make in your lifestyle today, you can see actually a really dramatic effect in about 3 months' time. So the big things I would say for men are smoking, cigarettes, but especially cannabis. We know that that really affects sperm quality and affects the way they move. Alcohol, especially binge drinking, can be bad for sperm quality. And then things like, so the testicles are outside of the body for a reason. So they're meant to be kept cool. So things like having really hot baths every day or hot jacuzzis.
I'm so childish. I'm just like, why am I laughing? Because the are outside. Like.
Right, but it makes sense, right? The outside having a hot laptop on your lap all day, all of that excessive heat can also affect your sperm quality.
Right, okay.
And then things like if you are a gym bro and you take supplements, especially steroids, that can turn off your sperm production completely. Okay. So those are really important things for men. And if you make those changes now, that can have a very big impact in like 3 months' time. Whereas for women, it's a little bit different. You know, we are born with all of our eggs. Even when we are in our mother's wombs, that's predetermined. And I also want to say that because I feel like a lot of people are having these tests and sometimes finding out that they have a low egg reserve and then feeling like really ashamed or really guilty that they've done something. But it's not something that you've done. Okay, you can make slight adjustments to your lifestyle to have a generally healthier lifestyle. But by and large, it's nothing that you've done to cause you to have a low egg reserve.
Okay.
Yeah.
And you can't increase it, can you?
So you can't increase it. But let me give you like a little analogy. So imagine that your ovary is like a bank account. And Aisha, you have £1 million in your bank account. And Audrey, you have £1,000 in your bank account. Now, each month, you can only withdraw £1. And that's basically each month that you ovulate, you can only release one egg.
Yeah.
Generally speaking.
Yeah.
So between the two of you, who do you think is going to have a higher chance of getting pregnant?
You'd think me, right?
Yeah.
It's the same.
Oh.
It's the same because you can only release one egg.
It doesn't make a difference.
It doesn't make a difference. Yeah.
Oh, yeah.
Okay. Yeah. And this is another thing that I tell people like several times a week, because your egg reserve does not, and you see a lot of people doing these at-home blood tests as well for AMH to see what the egg reserve is like. And I'm all for people doing tests and having more information, but you have to also just understand what it means, right? So having a low egg reserve doesn't change your chance of getting pregnant naturally each month. But that's about egg reserve, right? So that's about the quantity. That doesn't tell you about the quality of the eggs.
Yeah.
Right, okay.
And we don't have a test like AMH that tells us about egg quality. But what we do know is that your egg quality is closely related to your age.
Right, okay.
Okay.
And as we get older, that declines.
So, you know, when you go for like a fertility MOT, which I think we
spoke about, I had one.
We've both had one. Which we both have had.
Yeah.
That I am assuming is obviously, is that more thorough than doing the at-home test?
So it's part of it, right? So usually what happens if you have a fertility MOT, so if anybody is like thinking about having this done, depending on if you're a single woman or if you're going with a partner. So for the woman, you will have the blood test, the AMH.
Yeah.
You will have a scan. So we look at all, and the scan is really important as well. So it's an internal scan, looks at all of your pelvic organs. And I really feel like we should all have this scan done before we're thinking about getting pregnant, right? Because if you find out, for example, you have a condition like endometriosis or adenomyosis or fibroids, you want that information before. You don't want it at the point where you're like trying for a baby or you're maybe coming a bit later.
Yeah.
So you have the scan, and we also check the number of follicles on your eggs. So follicles are basically little egg sacs. They contain little immature eggs, and each month you will release one egg. But somebody who has a higher reserve, so say Aisha with £1 million in her bank account, she might have 20 follicles on her ovary. And Audrey, if you had a low reserve and you might have 5 follicles. But what happens each month is that you will ovulate from one follicle and the other 19 will die. And you will ovulate from one follicle and the other 4 will die. So as I say, no bearing on natural conception, but it is important to know that information if you're going to go through a process like egg freezing or IVF.
Okay.
So you'll have the blood test, you'll have the scan, take a full history, find out a bit about your past medical history, any previous pregnancies, about your cycles, just a full kind of top to toe. And then for a male partner, they will also have a semen analysis. And we know that actually male factor is involved in up to 50% of people who present with problems trying to get pregnant. So,
and a lot of women just think it's them.
Yeah.
A lot of women just feel like they're failing.
Yeah.
But actually, look, 50% is crazy. Well, it should be 50% really.
Yeah.
It takes 2, isn't it?
Yeah,
Exactly.
it should be 50%.
Yeah.
But a lot of the pressure is on the woman.
Yeah.
Like you're not pregnant again, you're not pregnant again.
Yeah. And I think we need to stop in general. We need to stop treating infertility. So infertility by definition means that you've been trying to get pregnant for 12 months. You're not using any you're having regular unprotected intercourse. And within that 12-month period, you haven't been able to get pregnant. But infertility is a medical condition. So we need to stop treating like fertility like it's a virtue or by not getting pregnant, it's shameful. There's something wrong with you. You know, like we wouldn't think about other medical problems in that way.
Yeah. And if someone wanted to think about egg freezing, for example, at what point do you think that they should start seriously looking into it? If they, for example, if they're single, but they know that they want to have children, or maybe someone that is focused on their career right now and they kind of just want to put it off. Like between the thought and actually going through the process, how long do you think you should give yourself?
Okay, so depends how old you are, right? So I would say, generally speaking, egg freezing, the younger you are, the better it's going to work, because we know that the quality of your eggs is going to be better. And those eggs are going to be frozen in time. So whether you come back to use them in a few years, they're still going to be made with your 28 or 32-year-old eggs or whatever it is.
Okay.
Generally speaking, the evidence around doing it after age 35 is a little bit less. But I would say if you are in someone who's like in your early 30s, you're single, but you know for certain that you want to have a family in the future, that's the time to be thinking about it.
What's the process?
Yeah, so the process, it's basically like the first part of doing IVF. So as I was saying, in a normal month, you would only ovulate from one of those follicles. So we basically give you daily injections, and it's the same hormone, the same signal from your brain to your ovary, telling your ovary to let one follicle grow, but we give you a bigger dose. So essentially we're trying to get all of those follicles to grow. But remember that we can only work within like the remits of what your ovary allows us. So if you have 20 follicles, in a perfect world, we would stimulate all 20 of those follicles. And in a perfect world, we would get all of them. In reality, we know it's a bit closer to 80%, but you would get 20 eggs. But in the same situation, if you have a lower reserve, the best you could hope, if you had 5 follicles, you can only hope to stimulate 5 follicles and get a maximum of 5 eggs.
Okay.
So I see a lot of the conversation around egg freezing, people talking about it being, well, it's a spectrum. Some people say it's like insurance. I don't think insurance is the right word, right? Because if you have insurance, if something goes wrong, your insurance is going to pay out. But it's not a guarantee, okay? And on the other hand, you see people saying, well, it's a scam, right? But we need to be realistic about, I would say it's not insurance and it's not a scam. I would say it's an investment, right? You are taking the time to figure out what you want, and you're trying to minimize chance. Like you're putting something in to hopefully get a return later on. So back to your question about what it actually involves. It's usually about a couple of weeks of daily injections to get all of those follicles, or as many as we can, to grow. Some people feel absolutely fine with it. Some people feel quite emotional or a bit up and down.
I was going to ask that actually, because there is a lot of people, I think, you always think of the financial impacts that IVF or egg freezing and stuff will have on you. But I've seen like YouTube videos and TikToks about how women talk about the emotional impact it has. I don't think many people know the emotional impact it can have. I mean, it's like you said, some people.
And we can never really predict who it's going to be. Like some people with the injections are like, oh, I feel fine. And some people are like, I'm all over the place kind of thing. But it's usually only for a period of 2 weeks. And then you have an egg collection. So that's a procedure that's done. You can have it under local anesthetic, but most of the time you're asleep. But it's not like a general anesthetic. You're still breathing for yourself. And it's the same way when you have an internal scan. But there's a very fine needle that goes into the ovary, and it basically sucks out the fluid from each one of those follicles. And then there's an embryologist who's waiting in the lab to see if that fluid contains an egg. And then you freeze the eggs. Now, when you freeze an egg versus when you freeze an embryo, an egg is one single cell. So it's a bit more fragile than an embryo, which is a bit bigger and more robust. So when you come back to defrost your eggs, whenever you decide that you want to use them, either with a partner or maybe you decided to use a donor, then we know about 85 to 90% of them will survive.
Okay.
And then with what you have left, how many of them will fertilize normally with the sperm? Now, again, it depends on your age, but let's be conservative and say about 60 to 70%.
Can a sperm and egg not be compatible?
It's not that it won't be compatible. Like, it depends, first of all, on the quality of the sperm. If the sperm is completely normal, you basically just leave the egg and the sperm in a dish and you let them fertilize. And then you come back the next day and you see how many of them are fertilized. Sometimes if you have poor quality sperm, what the embryologist will do is they'll do an extra step. So under the microscope, they will actually pick the specific sperm and inject it directly into the egg.
Okay.
So it's not so much that you would just have a sperm and an egg that are incompatible, but there might be other factors that will be affecting fertilization. And age also plays a role in that as well.
Because I was watching, I'm probably the only person in the world that still watches, but I was watching The Only Way is Essex, and there's a couple in there and they've been trying to get pregnant for a couple of years, and then they're having some sort of fertility treatment because I think something to do with his sperm and her body and his sperm were rejecting each other. So they're having some sort of treatment to fix it. But I don't understand if it's like a holistic thing, if it's an actual medical thing, but I don't know what that is. Is that a thing?
They're doing IVF or?
I don't think it's IVF. It's something about their DNAs not meshing well.
Okay.
But I don't know if they're being sold down a river. I've got no idea. But yeah, it's very, that's what it was.
Yeah. It's hard for me to say without knowing what
exactly. So that explanation was terrible. But yeah, something to do with their bodily fluids
not conjoining.
They're just not meshing.
Just not maybe that's a sign from God that they shouldn't be together.
maybe
they need to take it as a sign to go somewhere else.
They seem to think that they're having some sort of treatment that is gonna, it's his white blood cell is gonna be implanted into her or something to just get the process going. I don't know.
Okay, I'm not aware of this treatment, but we'll have to look into it.
I don't know what that is.
But you know what? I've heard something like that before where it was saying like different blood types or something, but I don't know if that was to do with miscarriages, like the baby's blood type was attacking the mom. I don't know. It's really
that's something different. Is
it true though?
There's something called rhesus incompatibility, so this is to do with your blood type, but that's usually something that when you are pregnant is identified in the pregnancy, and you might actually have something called anti-D, which is like essentially like a vaccination to prevent that process from happening. Okay. But the blood type thing doesn't affect your chances of you being able to get pregnant with somebody.
Okay.
Yeah.
Okay.
So what sort of things should people be aware of? You're not trying, you're not even necessarily thinking about it, but how do you know that your body is, as a woman, how do you know that your body is ready and okay for pregnancy? Or are there things that you can look out for when it comes to maybe your period or your ovulation?
Actually,
those things beforehand. Are there any red flags that you should be aware of before you even think about pregnancy?
I love that question because it's so great to be able to think ahead rather than when the problem is already there. So the biggest thing is your periods. So first of all, are your periods regular? Now, if you tell me that you have a regular period, like you can look at your calendar and within a few days know roughly when your period is coming, then you are almost certainly ovulating. So if you're ovulating, that's step one, right? Because what do you need? You need an egg and a sperm. Okay, but we're going to focus now on the woman. So if you're ovulating, you're having regular periods, then great. But then you also need to think about, how are your periods? So are your periods really heavy? Lots of us have, the first day is a bit heavier and then it kind of settles down. But if your period is so heavy that you are flooding, like you're leaking through like pads or tampons, you're having to use double, like a pad and a tampon, or leaking, or you're not able to go to work for the first few days of your period. Your period is probably too heavy. If you're passing clots that are bigger than a 5p coin, that's too heavy.
5p?
Yeah.
Oh, wow. Okay.
And does that have to be regularly for a certain amount of days? Or what if you just have like one blood clot every now and then?
Well, I mean, look, I think for a lot of us, like we'll say like on the first day it's a bit heavier, but then it settles down. But I think if it's so heavy that you are, and that will usually be, if it's something like fibroids, it will usually be throughout as well.
Yeah. There's pain to it as well. Like if you've got painful periods as well.
Yeah, 100%. Yeah. So, okay, yes, we expect a little bit of cramping when we get our periods, but if your periods are so painful that you can't meet your friends for dinner, you're not able to go to work, you're cancelling social activities. You have to stay in bed. Your pain is not relieved by like paracetamol and ibuprofen. Again, probably too painful. The issue is that we've always been told, or you might have gone to your doctor or just been told, oh, it's just women's troubles. Or, you know, you just kind of told you need to put up with it. But actually we know that, as I say, these things are not normal. And at that point, really, you probably want to be having a scan to see what's going on.
Yeah.
So if you have things like fibroids or endometriosis or adenomyosis, PCOS, yeah. So if your periods are really irregular, then that is one of the hallmarks of PCOS.
Yeah, I was diagnosed with PCOS when I was 19.
Yeah.
So yeah, I know all about about that.
So the way that we diagnose PCOS is that you usually check the box for 2 out of 3 symptoms. One of them is irregular periods. The other one is that you have high levels of male hormones, so androgens. So you might notice things like hair growing around your chin. You can even have male pattern like hair loss, like around the temples, acne. And the other one is the ultrasound aspect of having lots and lots of these follicles on your ovaries. Yeah. So you can see you can have 2 of these. You may not have ever had a scan, but you still met the criteria for
that was
PCOS.
me. I was at my boyfriend at the time's house, and all of a sudden I was in so much pain, and like I could not move. And his mum drove me to my mum's house, and we went to the hospital, and they gave me an internal scan. So I had all these cysts, and one of them was out the size of like a tangerine, and it had twisted. So I was in so much pain, but that's how I found out, because I had irregular periods, but at 19, I thought it was a gift, actually. I was like,
he was trying to have periods.
I was like, I don't have to have periods all the time. But I didn't have like facial hair or anything. I don't suffer from acne or anything. The only thing was the irregular periods. But also growing up in an African home, who talks about periods?
Yeah, exactly.
Like, you're not going to be like, oh, mum, my period didn't come. Because if I say to my mum, my period didn't come, you're pregnant.
Yeah.
So it wasn't something that I spoke about. But I got diagnosed when I was 19, and then when I was I've always had like cysts on my ovaries, and then I got pregnant when I was 25, had a miscarriage, got pregnant again a couple months later, had a miscarriage, and then I decided, no, I need to fix this like PCOS stuff, change my whole lifestyle and stuff, and then since I've been 30, I haven't had any cysts on my ovaries, which is great.
Yeah.
But it's irregular periods, pain.
Yeah. So irregular periods, painful periods. I would also say things like making sure that you have your STI screens, because lots of people will get chlamydia and have no symptoms, but chlamydia can affect your fallopian tubes, and your fallopian tube is where the egg and the sperm meet, right? So if there's any blockage or any issue there, then they basically may not be able to even meet there, or you might have a slightly higher risk of having an ectopic pregnancy, which is a pregnancy that grows outside of the womb. So stay on top of your sexual health screens, and have protected intercourse, generally speaking. And I think if you also have known conditions like any known condition really, like that can affect your whole body, like things like lupus or Crohn's disease or things like that, if you are thinking about getting pregnant, go and see your doctor, because a lot of these conditions, they will have preconception counseling. So you'll actually see a specialist even before you get pregnant. And the reason being is that lots of people with, health conditions will have very healthy pregnancies and safe deliveries. But if you go into a pregnancy with whatever condition you have well controlled, then chances are is it will stay well controlled. In the pregnancy. You want your water?
Yes, please. I'm just recovering from this cough.
You went to Dubai, and
oh my god, the
air conditioning ruined everything for you. I wanted to ask.
I'm sorry.
It's all right. I wanted to ask about people that have children. So like, I've got a son already, and then trying to get pregnant. I'm not trying to get pregnant again, but when people try to get pregnant again and then it doesn't happen for them, it can be very, because once you have a child, you think, oh my god, I've jumped over that hurdle, I can do it again. So you have a baby, and then you're trying again and it's not happening for you.
Yeah.
Is it the same rules just as like when you first started trying, or is there something that maybe happened in between? Because I know that probably there's a lot of couples or single people who've had a child, maybe done IVF, and the second round is not working.
Yeah, so we call it secondary infertility. So you've had a child before and you're now struggling to have another child, and that could be really tough. A lot of the time people are not expecting it, like as you say, we've done this before, the expectation is going to happen again. So there's a lot of guilt around that, and I think, you know, people say stupid things like, well, at least you have one child. I'm very against people saying at least you have anything when it comes to fertility. You feel grateful for the child you have, but that doesn't take away from the fact that you don't feel that your family is complete. So the first thing I want to say is that those feelings are very valid. But yes, it's a similar thing. You want to be making sure that your health is, you know, optimized for another pregnancy. I would also think about, how did you deliver your baby? So sometimes if you've had a cesarean section, or for that case, any surgery to your abdomen, that can cause scar tissue inside your abdomen, and that can potentially affect your fallopian tubes. It doesn't mean that, oh, you had a C-section and you're trying to get pregnant, something's happened. But, you know, it might be worthwhile getting a fertility assessment. And there's, on top of having the normal internal scan, you can also do a scan that checks if your fallopian tubes are open by putting a little bit of dye inside the uterus as well.
Of course, yeah.
Which can be uncomfortable, but it can give us a bit more information about the tubes. And I would also say that, you know, we can't underestimate the impact of time since our last pregnancy and delivery. So if it's a few years ago now, then that also does have an impact. But your chances are still higher if you've had a previously successful pregnancy.
And you know, so those people you people that are getting it in a few weeks after you've had, is that true? Because that's something we also want to talk to you about, this like just debunking some fertility myths and stuff like that. So when people say that you are more fertile after you've just had a baby, is that true?
So yeah, you are, you know, as soon as your cycles come back, and you can ovulate even before you get a period. So for those people,
after you've had the baby.
Yeah, so if you're, for example, breastfeeding, you might not get your period for several months. The thing is about using breastfeeding as a method of contraception,
tell them,
is there's a lot of little asterisks that you need to meet, which most people are not meeting, okay? So we know it's like actually about 98% effective if you do it in a way where you're exclusively breastfeeding, your baby's under 6 months. That means you're not going longer than 4 hours without feeding your baby. So if your baby's sleeping, you know, 8 hours, I mean, first of all, amazing. But this is not an effective form of contraception.
That's how people get pregnant.
But I love those people, because good for you, they're all multitasking. Because when I first had Anaya, that was like the last thing that was on my mind, especially when I was breastfeeding. So let alone people that are thinking, oh, this is a contraception. I love that. I honestly love that for you guys. But I always hear that about, oh, you're more fertile directly after you've had the baby.
Yeah, and so it can be the case, but I would say that think about the interval between your babies, because you need to give your body a chance to heal. It's not that feasible for all of us. A lot of us are having children in our 30s or later, so we don't really have that same luxury of time of being able to wait 4 or 5 years in between. Well, you don't need to wait 4 or 5 years, but
what would you say is a good time to wait?
So there's a lot of conflicting. There's not like a hard and fast rule for this, but we generally say 18 to 24 months between pregnancies.
Okay.
Yeah.
So not between birth?
Between pregnancy.
That's not bad.
From the birth of one child to the pregnancy with the next child.
Okay, that's not bad though.
Yeah,
18 to 24
And I would follow that more so if you've had a C-section.
I had the C-section and there was no way, within a year there's no way I could have another baby.
Impossible.
No way.
Especially if you're somebody who's thinking about that you might want to try for a vaginal delivery with your second, because I mean plenty of people will just choose to have a planned C-section.
Yeah.
And some people will try to have a vaginal birth. And there's a very small risk particularly in labor, because you've got a scar on your uterus, right? And your uterus is contracting against this kind of deficiency. There's a small risk, about 1 in 200, that the scar could actually open.
Rupture.
Exactly. So yeah, for that part, I would say, especially if you are gonna if you've had a C-section and you were thinking about having a planned, or you want to try and have a vaginal birth, then I would follow that a bit more.
I'm just gonna go back to that C-section.
I'm with you there.
And what about just another myth that I want to debunk? Certain positions
so any position where you can ejaculate inside the vagina has the same chance of pregnancy.
Doesn't matter if you tilt yourself upside down.
You don't need to lie with your legs in the air. You don't need to not go to the toilet. So from the time that you ejaculate, and there's millions and millions and millions of sperm.
One of them's got to get there.
In the vagina, they're going to travel through the cervix to the top of the uterus, and hopefully there's going to be an egg, if you want to get pregnant, waiting in the fallopian tube to fertilize. That process takes 5 minutes or less. So lying down for 20 minutes or keeping your legs up in the air, it's not going to change anything. And the other thing is also, for women, we know actually going to empty your bladder, going for a week after sex, can reduce your chance of urinary tract infections. So I would not be urging anybody to not go to the toilet after sex.
And what about
you've got loads of
I know. I want to know. I love these. Always wanted to speak to like an OBGYN. I've always wanted to. So what about? Okay, so you're trying to get pregnant, and we know that there's certain days in the month that you should your chances are higher. And obviously, if you use any of those apps, Flow app, and know, others are also available.
Okay, after that,
then obviously you can monitor like your fertility. Is it impossible outside of that window? Because those people that use that method of like the natural planning, natural cycles, like how accurate is that?
So this is a good point actually. So you have a fertile window, and I'm going to presume that you're trying to get pregnant, right? So your fertile window is the day that you ovulate and 5 days before. Because once the egg is released, she doesn't hang around. She's there for 12 to 24 hours, right? So if you miss ovulation, then you've missed the chance for that month. But sperm can survive for up to 5 days.
Those crafty little so-and-sos.
So what you want to do is you want to work out roughly when you ovulate. So you can use these apps, and the apps basically depend on the fact that the second half of your cycle, or the luteal phase, which is after you ovulate.
That's how you pronounce it. I never knew how to
pronounce it. Luteal.
I always see it and I'm like, is it Lufia?
It's usually fairly fixed at 14 days. But the problem is that people have different cycle lengths, right? So someone might get their period every 25 days and someone might get their period every 32 days. So the person who has, let's say, a 30-day cycle, if you count backwards 14 days, they will be ovulating around day 16. But the person with a 24-day cycle could be ovulating around day 10. So it's no good to say, well, I started my period today, so 14 days from now, I'm going to be ovulating. If you don't have a 28-day cycle, that's not going to be the day that you're ovulating. So the apps can be really good for tracking ovulation. And there are a few other ways that you can track when you think you're ovulating. You can do something called an ovulation predictor kit. So people do the LH test. Yeah, exactly. So
are they accurate? They are.
They are accurate if they work for you. So some people, if they have really irregular cycles, so they measure this hormone that basically goes up before you ovulate. They measure it in the urine. So when you get this LH surge, you will ovulate 24 to 36 hours later. So what you want to be doing is you want to be having sex before you ovulate. Because like I say, it's the 5 days before and the day of ovulation, and that's
not
it.
afterwards.
No, if it's like the next day, the egg is probably already gone. So that's why you want to start having sex like 2-3 days before you think you're going to ovulate, because you want the sperm there waiting, ready to meet the egg. Do you know what I mean?
I always thought it was like afterwards, after you ovulate.
Yeah.
Well, if it's straight after you ovulate, but the thing is, we know roughly like the day that we ovulate.
Yeah,
and it's only going to be there for 12, 24 hours tops.
So in those apps, when it says hi, that's when she is here and ready, honey. And then when it goes down to medium, it's like, I'm going out the door now. And then when it goes down to low, she's gone.
So when it's high, it's usually going to tell you like a day
before.
Yeah. And well, even earlier, 2-3 days before you want to start having sex.
Okay, because it's saying like have them there and ready.
Okay, be prepared.
Yeah.
So how comes, when you do get pregnant and then it tells you, okay, so how comes it starts from the first day of your last period if you had sex after?
Do you mean like how we calculate the pregnancy?
Yeah.
It's just kind of like a standardized way to calculate pregnancies. So you kind of you get 2 weeks basically added on.
Okay.
But yes, I mean, in theory, it's 2 weeks less, but it's just so you have like a standard way to calculate the length of a pregnancy.
Okay.
Yeah.
But so you have sex, and that obviously is when the pregnancy is formed. Like that's when what would you call it?
That's when hopefully when fertilization happens.
Fertilization. Yeah.
So that meeting and that fertilization is going to happen in your tube. Now, over the next 5-6 days, it's going to be making its way into the into your uterus, into the lining of the womb, where it's hopefully going to implant. And implantation also takes a few days. So that's why you can't, for example, have, you ovulate and have sex today. You're not going to get a positive pregnancy test tomorrow, because that process of fertilization and the embryo making its way into the uterus and implanting into the lining of the womb takes a few days. And so usually that's why we say when you miss your period, that's when you take the pregnancy test.
Is there implantation bleeding?
You can get implantation bleeding. So this is one of the things I feel like is kind of a bit cruel about the female body, because some of the symptoms that you get in that second half of your cycle in the luteal phase is like you're pregnant, right? But it's progesterone. So you might feel that your breasts are tender, you feel bloated, nauseous, low mood, etc. And that could just be your luteal phase. Yeah. But it could also be that you're pregnant. You might get spotting. It might be that your period's coming, or it could be an implantation bleed. So you can't read into those signs too much. Yeah. It doesn't tell you for certain either way if you're pregnant or not. You kind of just have to wait it out. Wait till you get to that missed period. Yeah. And take a test.
Is there any like fertility drugs that people could be on to enhance their chances of getting pregnant, or like changing the quality of their sperm and stuff?
So there's no like magic kind of supplement. There's a couple of things I mentioned about taking folic acid and vitamin D just for a healthy pregnancy. There are certain supplements that have some evidence, but only for certain conditions. So somebody with PCOS might benefit from things like metformin or something called myoinositol, but it doesn't work just for everybody trying to get pregnant to take this medication. Yes, there are lots of herbal things out there. They probably don't cause harm that we know of, but they probably don't dramatically change your chances of getting pregnant. It just takes time. This is the thing, Audrey was saying earlier that you don't expect problems with getting pregnant, and so also we don't expect it to take time, and when we're ready like now, which is tough, right? But it just you should mentally prepare yourself for about 12 months of regular unprotected intercourse to give yourself a really high chance of getting pregnant. But if it doesn't happen in that period, if you're under 35, after 12 months, you should go and see your GP. If you're over 35, after 6 months, you should see your GP. Unless you have a known condition, you have something already, that you have endometriosis or adenomyosis, etc., then don't wait, right? And especially also if you have irregular periods, because it becomes very difficult to know. Okay, well, first of all, if somebody has 12 cycles in a month compared to somebody who has 6 cycles in a month, in a year, sorry, they already have half the chance. They have half the opportunities to get pregnant. And also, if your period is not coming once every 2 months, it might be 1 month is 30 days and the next month is 50 days. how are you going to be I mean, you could just be having sex every other day, which is fair enough, but if you're trying to time it with your fertile window, that becomes very difficult to do when you don't know when you're ovulating.
And also mentally must be so draining.
It's very draining.
It must be so draining.
So one thing that I'm really, really passionate about is this idea of like geriatric pregnancies, aka if you're over the age of 35 and pregnancy over the age of 35, because we're both over the age of 35. I'm 39, I'm going to be 40 next year. A lot of my friends have been doing it later, and I think that that's the number one thing that people gravitate towards me about, because I'm very open about it. I talk about it all the time. I had a Naya at 37, and I do want to have more kids, and obviously I'll be older when I do, God willing. And I always hear, like, I don't know if it's conspiracy theory, I don't know how true it is, but like, is there any correlation between the age 35 and just life expectancy? And where did that number come from? And is it true? Is it a myth? Or is it very much on a case-by-case individual basis?
Yeah. So we know that fertility, as I say, women were born with all of our eggs, right? And they decline over the course of our lifetime. So let's take a woman who's under 30, who is trying to get pregnant. In a 12-month period, 85% of those women will be pregnant. Now, at 40, in the same situation, that drops to about 44%. So it halves. And it's this gradual decline that happens over the course of our 30s and then into our 40s until it's very, very difficult to become pregnant naturally at 45. But it's a gradual decline, and it's probably a bit more of a sharper decline after age 37. But, you know, the problem is, I think that this number about 35, and it's kind of used as like a stick to beat women over the head with and to shame them, right? You know, we need the information, we need the knowledge so that we can make decisions now for our future, but it's not something that should be used to shame or stigmatize, you know?
Yeah.
Because, you know, there's, on one hand, you could say that talking about these things, it's like, oh, it's fear mongering or it's scaring women, etc. But to that, I would say, like, what's the alternative?
Yeah.
In 5 or 10 years' time to say, nobody told me this information, or I wish I'd known. I think the regret of that is much worse than having to kind of have difficult conversations now.
Absolutely. I completely agree. I think it's better to be informed than not be informed.
Yeah. Because
I feel like with my pregnancy journeys, so my first pregnancy was at 25 and I had my son at 25, sorry, and I had my son at 35. So that's 10 years of trying to have a child and starting and not knowing anything. Like we were saying earlier, you just think you can get pregnant. And I did just get pregnant, but then there's all these other hoops you have to climb in between that. So yeah, I absolutely believe that if you've got, no matter how scary it is, and that's why we spoke about the fertility MOT and stuff in the first episode, no matter what the results are, even if they are quote unquote bad, at least you've got the information and okay, let's put the steps in now to figure out what's next, you know? But yeah, that 35 number always scares.
It is. I feel like it is thrown around a lot, and I just was always confused about how true is it versus how much of it is fear mongering.
Yeah, I think it is. You know, I think there is a gradual decline, but to that I would just say that if having a family is something that you want in your life, then I would just take the steps now to just find out what's going on, find out what the lay of the land is, find out if you have any conditions that could make that more difficult in the future. Like, have this information now so you can make decisions rather than having regret years down the line because you'd wish you'd known.
Is that the same for men? Do men have an age where their sperm starts to deteriorate?
Yeah, so sperm quality does decline with age. It's not the same as for women because men still produce sperm every day, but the older they get, the sperm quality does worsen. And we know that that is also linked to higher rates of miscarriage in the female partner. And yes, it has implications. It's not as dramatic for men, but you know, it's still half of the equation.
So the sperm, what word am I looking for? The quality of the sperm, can that impact a miscarriage?
Yeah.
Okay.
Yeah. So you can have something called DNA fragmentation. So sperm has a very high rate of DNA error. So when you look at sperm under a microscope, we actually accept 4% of them looking normal under the microscope.
Oh, wow.
Whenever I say that to people, they're like, oh my God, that sounds really low. Yeah. We hardly ever see people with normal forms, i.e. normal appearance in the microscope, in the double digits. When, you might think it's a lab error or something if you get a really high reading.
So miscarriages potentially could not be the fault of the woman.
So, one thing I would actually say is, I think if you are coming as a couple, you should ideally be thinking about achieving a pregnancy as a couple, right? Like you say, I mean, the blame has always been with women, even when it's not the case. I see women who have everything completely normal, but they need this type of IVF where the sperm is injected into the egg because the sperm quality is really poor.
Yeah.
And for some people, they might feel that kind of levels the playing field, like knowing that actually this is not just my
me.
Yeah.
But at the same time, I would want people to think about, we're a team, right? We're trying to have a baby together, and not to kind of avoid being like it's your fault. But the thing is, fertility treatment or infertility can have really huge impacts on relationships.
Oh, absolutely.
Yeah.
I was asking on a personal level, that's all, because I was just like, you just have miscarriage, just can't hold a baby, but maybe it wasn't me.
Yeah, and I feel like as women, women are always doing the work just to spread the message about, miscarriages are not, it's not your fault, you're not to blame. There isn't anything you could have done. Sometimes it's just nature taking its course. It's got nothing to do with you. And I really want men to do that work for them as well, so that they don't have the same stigma and the same shame attached to if they are the reason why a pregnancy isn't formulating. Like it's actually okay. There's things that we can do and just remove the shame. But I feel like we can't do that for them. They kind of need to have these conversations, and I don't see them having these conversations.
Also, being somebody who went through multiple miscarriages, I know I didn't have that conversation with my son's dad. So it was, I internalized it automatically. And it was just like, I'll figure out what's going on.
Yeah.
But actually, we also need to be like, something's not working here. So we need to see someone together.
Exactly.
Not, I'm going to the doctor.
Yeah.
Like,
this is our shared goal.
Yeah, it needs to be like a joint thing. Like, let's go and have this conversation with a doctor or someone and not internalize it ourselves and then beat yourself up about it, because I didn't know that 4% of sperm is okay, not okay, but like the normal. DNA is normal. And maybe if I did, I may have been like, maybe we both need to go and have a look at what's going on.
Well, you absolutely do, like, because you're doing this as a couple, right?
Yeah.
And that's one thing I always say to women when I see women who are having a miscarriage, whether they ask me or not, because I know that thought is there. There's nothing that you've done to cause this, and there's nothing that you could have done to prevent it.
Yeah.
But we do internalize that guilt. But I'm sorry you went through that.
That's awful. I think what you said is so true about the 35 thing. At the end of the day, if you want to have a family, you just have to put these things into place regardless. And I just think that maybe not to focus so much on the age, but to focus on like what you want out of life, and just to think about what that looks like for you in different stages of your life, regardless of whether you're 35 or not. If you know you want these things, then just start doing what needs to be done.
Because it's crazy when you want to get your hair done and you want like a specific person to do it, you will wait out and you will make it work.
You'll be researching, you'll be saving money for it,
You do all of, when there's other things in your life going on that have that's not going to have any impact as much as you having a child. If you want to start a family, you do the work, you do the research, you go to wherever you need to go, you go and buy the hair, you go and buy whatever it is, like you do it all. So we need to put more effort into it and not be so crushed when it doesn't go right, because actually what steps have we made to get us in a better place, with a better result. And if the result ends up being that you can't get pregnant naturally, then okay, let's look at other alternatives, because let's be honest, not everybody's going to be able to naturally get pregnant, regardless of age. It could be all different factors like you've mentioned, but that doesn't mean you having a family stops there. There are so many other options, that you can hopefully visit and explore.
And actually that leads me on to what I wanted to ask. Is there such a thing as like there's, for some people it is completely impossible, or is there always a way just because of the way technology is developing at such a fast rate?
Yeah, so it depends, right? It depends on what you want your family to look like, because there's so many different ways to make a family. And even if the chances are low, or you have what we call unexplained infertility, like, you know, you've done every test and everything is normal, but you still haven't gotten pregnant, then treatments like IVF are still the treatment of choice. And we know that when we look at the data, the thing that gets us to a live birth the quickest is almost always with IVF.
Yeah.
It's not a blanket treatment for everyone. And, you know, some people, for example, go through the menopause very young, and that can be like a genetic kind of thing. There's the possibility of using things like donor eggs, where you will still be carrying that pregnancy. You know, there are different ways to make a family that is maybe not the conventional way that you've thought about, but there are still options out there.
Yeah.
And what about, because now obviously we're two black women, so we have to just talk about
100%
race and how that shows up in this whole entire space. So we always hear about that statistic. Is it five times more likely?
Yeah. It's gone down a little bit now.
Yeah.
It's 3.7 now.
Okay.
But still, it's not great.
That's good to know. It's not amazing, but it's good. It's good to know. Where do you think that stems from, this medical racism that impacts black women so much?
So let me take it back a little bit to even before pregnancy, to the fertility side of things, because this is one of the big things that kind of spurred me on to get on social media and thing and have a little bit more representation, is that black women, when they come to the point of fertility services, they come much later than their white counterparts. So what we see is that we're already really behind the game at the point of us seeing you, right? And the difficult thing is that if you're coming, you know, now you're in your early 40s, and we're now seeing, okay, you have really significant fibroids, you might need an operation before you have an embryo transferred. The operation is not a small operation. You're going to have to wait a few months to have it. You need to recover from the surgery. That now puts us back another year. So we're seeing that becoming a lot later. And I think there's also a lot of, well, we know there's stigma and shame in our communities about infertility. And I think a lot of people turn to either burying their head in the sand. Some people use their faith for comfort, and I think that's amazing. But what I will say is that can go hand in hand with
action,
still having action, having investigations and having treatment.
Absolutely.
I don't think that you need to be in a state of denial or kind of ignorance. You know, by all means, like your faith is there to guide you, but that can go hand in hand with, you know, having treatment.
I absolutely agree.
Yeah. So yeah, that's one of the really hard things, is that we just think, God, if you had come a few years ago, it's not impossible now, but it's so much harder. You know, and again, we're starting on the back foot.
Yeah.
So that's one thing that I would love to urge people to do, is as soon as you think there's a problem, as soon as you're worried about your periods, don't take no for an answer. Don't take somebody telling you that, this is fine, this is normal, come back in a year. If you think that there is a problem, speak up about it. And if you see somebody that you feel dismisses you or ignores your problems, see somebody else. You are entitled, even in the remits of your GP, to have a second opinion. And I would always say, ask to speak to a GP with an interest in women's health. They're more likely to be able to give you better care in those situations. And also push to be referred to a fertility clinic. You know, GPs have so much on their plates and they can't be expected to know everything, but the criteria around who gets to be referred or who gets to have IVF funded on the NHS is changing all the time. So, you know, even now in parts of South London, you can have IVF if you meet certain criteria, you could be having an NHS funded IVF cycle until the age before your 43rd birthday.
Wow.
Yeah, and I've seen people who have come to the clinic and said, well, my GP wouldn't refer me because I'm over 40. But actually they were eligible. And by the time they've come, because they've realised, yeah.
Oh my gosh.
So that's one thing I would say is just advocate for yourself.
Yeah.
Take somebody with you. Write down questions. Ask to speak to somebody else. That's from the fertility perspective. But yeah, then there's a much bigger question around maternal mortality. And yes, part of that is entrenched in medical racism and this idea that Black women have a higher pain tolerance, or they're more likely to be seen as like complaining or aggressive or combative, all these kind of things. We're already they're kind of met with a bit of like suspicion.
Yeah, I heard the term for the first time the other day, a WW. Have you heard of that before? Which is, it might be an American thing because it was on an American TikTok, and it was basically a panel of...
Is it Worried Well?
No, it's Whining Woman.
Oh
wow. Yeah, so there was this panel of like white American female doctors, and one of them was talking about their experience, and she was saying that this woman had come in. She didn't mention the race. She just said it was a woman that had come in with really severe abdominal pains, and she was complaining and blah, blah, blah. And she was in the waiting room, and the doctor had come in another doctor had come in and said, oh, by the way, you're dealing with a WW. And then she was like, what the hell is a WW? And she was like, a whining woman. And it's just like a code that is used to describe women just over exaggerating, their pain or things that they're
over exaggerating.
Yeah, exactly. And it's just like, what metrics are you even using to decipher that someone is just whining versus someone actually in a lot of distress? Like it's so sexist, it's so crazy. Sexist, and then when you add the extra layer of race onto it, it's a whole other thing. And when I was in hospital, do you know what I would say? When I had I had a pretty good experience, but then at the same time, I don't have anything to compare it to, but I felt like I had a pretty good experience up until I went into labor. And my hands and feet were really swollen, like so swollen. And so I was in a lot of pain, and I felt like, no, there's no way I'm not dilated. Like, is it dilated? And I was like, I must be 9 centimeters. Let's go to the hospital. And I got to the hospital, and she was like, ma'am, you're 0.5. I was like, oh my God, this is so embarrassing. But my hands and feet were really swollen, and I'm really blessed. My mum's a midwife. Yeah. So she was with me, and my mum was like, no, her hands and feet are abnormally swollen. Can you check her for preeclampsia? Yeah. And the midwife at the time was like, oh, no, it's fine. She's in labor. This is just a normal symptom. And my mum made sure she tested me. And then when she tested me, I had it. So once I was diagnosed with preeclampsia, they had to admit me straight away. I mean, I still had to wait 5 hours for a bed, honey. But, the fact of the matter is, I'm the kind of person, I'm not, especially when I'm in situations where I feel like people know more than me. I'm like, who the hell am I to argue with a doctor? What do I know? So if I'd been on my own, or I'd just been with my husband, he wouldn't have known what the hell to look out for. I wouldn't have known, because the last test I had, they test you for preeclampsia at your last appointment, and I didn't have it, and that was a week before. Yeah. So I was like, oh, there's no way. So if I didn't have my mum there, I would have just gone home, and God knows what the outcome would have been. So advocating really is, you just, even if you, and I'm speaking to all the people that are a bit more passive, you kind of just have to just grow some balls and just do it. You really, because it is literally a matter of life or death in those situations.
You do. And when it comes to the fertility side, at first, when I had my first 3 miscarriages, I was kind of like you, and was just like, I was kind of taking what the doctors were saying. But then afterwards, I was just like, no way. There's no way I can get pregnant and then something happens. Like, I have to know what's going on. And I'd done the research, and then I paid for like a private fertility doctor and stuff, and went to the London clinic and had loads of like tests and stuff with them, and really advocated for myself. And when it came to my son's pregnancy, I told my private midwife and the private sonographer, I used all of my history. And then the sonographer told me about, at the time, I think it's on the NHS now, but they give you progesterone, pessaries. So he told me about those. He was like, make sure we get those for you. Got me a prescription, and I was on those for 4 4 or 5 months, I think it was. But if I didn't, I would have just accepted everything that I was told beforehand.
Yeah.
And that's why my son is here now.
Yeah.
So you do have to push, you do have to advocate for yourself. And it's not impossible. Don't always take what the doctors are saying.
Yeah.
I mean, obviously they're professionals, they know what they're talking about, but sometimes it's wrapped in bias and not really, they can't really see you.
Yeah.
They just see like another person. So yeah.
Yeah. And yes, doctors are, have training, etc., but you know your body better than anyone else, right? But actually, what you were saying about miscarriage, I think that's one of the most cruel rules about this idea that you have to have 3 miscarriages before you can get referred to a recurrent pregnancy.
And even after my 3rd one, they didn't refer me.
Really? Yeah.
They just said, oh no, you're still young.
Yeah.
It's just...
The rules around that are actually starting to change now. They're starting to relax a bit now to more like 2 miscarriages because it's just unfair to say to somebody you need to experience 3 losses.
Before somebody can look at me like
that is crazy. Yeah. They definitely need to change that language.
Especially if you're young. If you're because if you start getting pregnant at 21 and by 23 you've had 3 miscarriages, some doctors or GPs will just be like, oh, you're young.
Yeah.
It's just...
Yeah.
But you've had 3 miscarriages.
Yeah, and that's a huge emotional and physical toll.
Yeah. So it was crazy to me when I heard about the 3. I was like, what? I was like, I'm not waiting around for this.
Yeah, and I mean, it's great that you had those tests. I guess not everyone's going to be in a position to be able to pay for those things privately or even know to do those things really. But yeah,
it was expensive. By no means was it was not cheap. Like it was not expensive. But how I paid for them was because I was like, Aisha, you can go out for dinner with your friends and spend £150. If my friends invited me out to dinner every weekend, I would spend £150 every weekend out at dinner and drinks.
Yeah.
Like if this is going to cost me £800, £900, just don't go out that. What's more important?
Yeah.
Like don't go out that month. Chill out, spend what you need to spend on, and that's it. People spend £1,000 on hair.
Yeah.
It's very
like that. You could definitely see a clinician.
Yeah.
With less than £1,000.
100%.
So.
Yeah, I mean, it's a few £100s to maybe like around £300-400 to go and have a full fertility MOT for a man and a woman. So
when I done mine, I think mine was $225.
Yeah, I mean, we'll vary a couple of clinics and things.
Yeah, 300.
How much?
300.
300.
Yeah. But yeah, like I say, it's an investment into your future.
Absolutely.
Yeah.
And you will spend that £300 doing something so easily.
100%.
Buy a pair of shoes. Like designer shoes these days are like £800, £900.
Exactly. There you go.
So that's 2 of those.
Yeah.
3 actually. My maths is terrible.
So what's true, because we're going to start wrapping up soon, which is, we could probably talk.
I know, honestly, I could
talk forever and ever, but you might have to come back and do part 2.
Yeah, I'm happy to.
Yeah. So what is the truth? Is there is there a decrease in fertility, or are people
just not
doing it later?
Yeah.
And just doing it later and everything's fine? So conflicting.
The kind of general decline in fertility or birth rates is probably more to do, not with us being less fertile, it's probably more societal things.
Yeah.
One of the biggest reasons that people cite is the financial cost. I mean,
it's so expensive.
Like nursery, my God.
It's so expensive.
It's like, especially in this country, I don't know, I think it may be less in other European countries, but like daycare or nursery is like prohibitively expensive, and people just don't feel that they're in a financial position to start a family now. And also, we're delaying because we have other life goals that we want to achieve, and we have careers, and
are people coming to you more asking you questions about like freezing their eggs?
Yeah, massively. And I'm seeing a lot of young women who are coming and freezing their eggs, and their companies are paying for them to do that.
Oh wow.
Yeah, a lot of like tech companies. So that's
interesting.
Yeah, it is interesting. I wondered what their like maternity policies are like, but
exactly.
It better match. It better be just as intense.
Because actually, it's like it sounds like a good benefit.
Yeah.
But actually, you just don't want women having children.
Yeah.
Yet until they've done what you need them to do in the organisation or whatever.
Yeah.
So
So great if your company pays for it. I would be interested to know what their maternity policy is like as well. But yeah, you're getting a lot of more people coming and freezing their eggs. You're getting a lot of couples who are in committed relationships or marriages who are coming and saying, we want to have kids, but not now. So we just want to know like the lay of the land kind of thing. And then, so that's interesting. That's definitely something we're seeing more.
Do you see people freezing embryos?
Yeah.
Yeah.
So obviously if you come as if you freeze eggs, those eggs belong to you. If you freeze embryos, they're both of yours.
I was just about, this is the last question I'm going to ask around that. This is the last question I'm going to ask. When it comes to freezing an embryo, is there legal implications about that? Because
100%.
Because is it almost, because it's almost like having a child.
Like a contract.
Yeah. It's a human gamete. It's a human, not a human, but it's a human gamete, and it belongs to both of you. So you have to go through legal paperwork to say, for example, if one of you dies, what happens to these? Are they going to be discarded? Are you going to allow the other person to use them in the way that they choose? So yes, there's a big legal framework around freezing embryos.
Yeah, because I can't remember what celebrity was it Sherry Shepherd who had that situation with her ex-husband, and they froze embryos and then split up. And I think it happened
in America, right?
Sofia Vergara as well. That was like a big thing where they had these embryos and they split up, and she didn't want to go ahead with, furthering the pregnancy or implantation or whatever, and he did. And there's a couple of stories where, like, celebrity stories where there's like big battles going on and what happens when you break up. And then I think with Sherry Shepherd's husband, it went ahead, and then he was like, I don't really want to raise this kid anymore. And then I was like, oh hell no, ain't no way.
I would take him to court.
You better, and I feel like they were in court for years going back and forth about this child. But I get it, anything can happen. But I think by the time people make that decision, you have to be pretty solid or pretty certain. I don't know. But I get it.
I mean, look, I've seen situations where a man and a woman have come together, and the woman they made a decision to, when they get the eggs, she'll freeze half of the eggs and use the other half to create embryos.
That's very smart.
So I mean, if you are in a committed relationship, if this is the person that you want to have children with in the future, it makes sense to freeze embryos, because embryos are a little bit more robust than eggs. Like I said before, eggs are a single cell. An embryo is like 300 to 500 cells, and also you've already been growing it for 5 days, so you already have more information, because now, okay, well, I've got 6 good embryos. That gives me a really high chance of having 1 or 2 children. So you're getting more information, but yes, you just have to remember that they belong to somebody else as well. Yeah.
Sorry, one last question. This is actually the last question. It's around twins. Can you increase your chances of twins? Can you decrease your chances of twins? Is it just the luck of the draw, or what is it with twins and that kind of multiple pregnancy situation?
So twins have a tendency to, non-identical twins have a tendency to run in families. And we see, like, in certain parts of the world, especially Nigeria and Yoruba tribe, they have a higher rate of twins.
It's because they eat a lot of yam.
We're not exactly sure, but we think it's something to do with lifestyle. I've heard that as well. I'm going to have to check that in the literature. But when it comes to identical twins, so that's how it happens naturally. Now, the chance of having not like twins naturally is, like, in the general population about 0.5%.
Oh, really?
Yeah. Then when you look in the IVF population, it's between 2 and 3%.
Right. Okay.
It's still small, but it's significantly higher than the general population. Back in the day, we used to often transfer more than 1 embryo at a time. So people would put 2, sometimes 3 embryos. We sometimes see people doing that abroad and coming back with twins or triplets or quadruplets. Now, everyone thinks, okay, twins, we just think it's sweet, right? But
not me.
Oh, you want to know to avoid.
Yeah, exactly. I do not want no twins.
Yeah. But multiple pregnancies, they do carry higher risks for both the babies and the mother. So, in general, in IVF, we've moved away from transferring we tend to just transfer 1 good quality embryo. You don't want to make them compete as well for resources in the womb. So success rates are slightly better if you just transfer one good quality embryo at a time. But you still have a slightly higher chance that it splits and you can still get twins that way. Yeah.
So when the egg splits, are they always identical?
Yeah.
Okay. Because it's one egg, isn't it?
Yeah, I got twins.
If you have non-identical twins, it's basically just like, because you can be a brother and a sister, right? You're like in the same place at the same time.
Yeah.
Yeah.
Okay.
Yeah. I got twins. I actually wouldn't mind having twins.
Yeah.
If it was first, then cool. But now that I've got one, because I actually
wouldn't mind going out the band.
I wouldn't mind three. Because I've just decided
it's efficient, but you know.
Actually think about it, because probably by the time I have another child, I'll probably be in my 40s. Can't run around.
Yeah. I mean, at least you have Ishi to help.
Like to help. Probably running in the other direction. This has been such a good chat.
Honestly, this has been amazing.
I've learned quite a bit today.
Good.
Quite a bit.
It.
Yeah. I hope you have enjoyed it.
I have.
Absolutely.
Yeah. Tell everyone where they can find you, where they can follow you.
Yeah, so I'm on TikTok and Instagram. It's Fertility Dr Nagla, DR. So yeah, you can find me there, and I just make sort of bite-sized educational videos, mostly about the things that we've been talking about, but for wherever people are in their kind of fertility journey.
Amazing. Yes, make sure you follow her. That was such a good conversation.
Yeah.
I feel like, the people need it and they're going to love it. So thank you so much for taking the time out to sit with us today. Yeah. You have to come back. Like, I feel like...
Yeah, I think we're going to get so many questions.
I feel like we're going to get so many
not going to be able to answer these.
People
I'm very happy to. I've had a great time. So
amazing.
Thank you guys.
Yeah, we've had a great time having you here. Thank you so much.
Thank you.
And we'll see you guys on the next episode.
Bye.
Bye.